We will begin in about 3 minutes. We will begin in about 2 minutes. All right, Tracy, I have 2 o'clock.
Good afternoon. Thank you all for joining us today for our bi-weekly update of COVID-19 across the Lake Cumberland District. We have some members of our executive team that will be answering the
You're probably a little microphone.
questions that you all have submitted. Sean, I'm going to turn it over to you and let you give an update if you don't care.
All right. As of yesterday, we had 1,180 cases total for Adair, with 39 deaths, 1,042 releases, 99 cases still active, 93 on home isolation, and 6 in the hospital. They have a 7-day incidence rate in Adair County of 72.17 right now. In Casey County, 798 cases, 23 deaths, 715 released, leaving 60 active cases, 53 isolated, 7 hospitalized. Clinton County, 672 cases, 16 deaths, 569 released, 87 active, 81 hospitalized, 81 self-isolated, 6 in the hospital. For Clinton County, that's 131.42%, 7-day average incidence. For Casey, that 7-day average incidence was 76.91. Cumberland, 363 total, 4 deaths, 322 released, 37 active cases, 33 isolated, 4 in the hospital. 7-day incidence rate, 95.04. Greene County, 700 cases, 11 deaths, 645 released, 44 active, 37 home isolation, 7 hospitalized for a 67.9 per 100,000 7-day average incidence rate. Macquarie, 859 cases, 2 deaths, 732 released, 120 active cases, 109 isolated, 11 hospitalized. That's 130.99 per 100,000 7-day average incidence. Pulaski, 3,022 cases total, 40 deaths, 2,636 released, leaving 346 active, 320 on home isolation, 26 hospitalized, and an average incidence rate of 86.4 for 100,000 new cases per day, average over the 7 days. Russell County, 1,005 total cases, 26 deaths, 846 released, with 133 active cases, 126 of those isolated, 7 in the hospital, for a 91.66 average 7-day incidence rate. Taylor, 1,519 total, 14 deaths, released 1,356, total active cases 149, isolated 143, and 6 in the hospital, for a 7-day average incidence rate of 81.49. Wayne County, 1,020 total, 5 deaths, 854 released, 161 active, 151 of those isolated, 10 in the hospital, 7-day average incidence rate of 138.41. And total for the whole district, this is through Tuesday night, so don't think we updated this for the morning, so we may be a day off with these days, but it's pretty close with where we are. Total cases through Tuesday night, 11,138 in our district, 180 deaths, 9,722 released. Total active cases, 1,236, 1,146 on home isolation, and 90 in the hospital. So, kind of give you an idea of what our growth rate has been doing the last little bit. By the way, Tracy, this coming through okay? Good. So it took us 133 days to get our first 1,000 cases in our district. It took 34 additional days after that to get our next 1,000, to get to 2,000. 33 additional days after that to get to 3,000. 21 days to get to 4,000 additional days. 13 additional days to get to 5,000. 10 additional days to get to 6,000. 5 additional days to get to 7,000. 7 additional days to get to 8,000, 6 additional days to get to 9,000, 5 additional days to get to 10,000. So, and now we're up to 11,000. I'm not sure how many days it took to get to 11,000. I'll look that up in a few minutes while we're going through the questions. But anyway, the growth rate has been fast. You can see how much quicker it gets to the next 1,000 cases than it early on. The one point of good news. The last 3 days, we've had fewer new cases for the last 3 days than we had on the equivalent days of the previous week. So hopefully that means cases are starting to slow down. That certainly doesn't mean it's a time to let up in our communities. We let this thing get away from us once. Maybe we're starting to plateau, so if we will all remain vigilant, maybe it won't get away from us again. Especially around the holidays, be vigilant. There's a temptation and the desire to, group up with your families and so forth. And it's just not the right time of year to do anything where you're going to be around crowds. So, Stuart, Dr. Wayne, do you have anything to add to that?
No. Thank you. Okay, I want to remind everyone that as I ask the questions, if you have questions that pop up, please type those in or some thoughts, type those in your chat box. We'll answer as we go forth. I'm going to go ahead and start the questions.
Tracy, before we start the questions, I do have a vaccine update. Very brief. Of course, there's 2 vaccines out there, one from Pfizer, one from Moderna. Earlier this week, we saw the Pfizer vaccine shipped to 11 healthcare centers around the state of Kentucky. None of that vaccine shipped to anyone in the Lake Cumberland district due to some restrictions with storage of that vaccine, the ultra cold. The Moderna vaccine will be going through its emergency use authorization this week, Friday and Saturday. We expect that to be approved by FDA and through the CDC. And then we will start receiving Moderna vaccine. We're looking to receive that sometime starting next week. as of right now, that will be a push from the state. In other words, we are not ordering that vaccine for the first shipment. They will push out a quantity to the health departments and to the hospitals in our area. And then it will be up to both the hospital and the health department to start vaccinating those healthcare workers with those doses. So again, we look for that to happen sometime next week. We're unsure about the numbers that we're going to get. However, when we do get those, then both the health department and the hospitals will be vaccinating those Tier 1A workers who are our direct patient care healthcare workers.
And Stuart, I did get the numbers to get from 10,000 to 11,000. It took 5 days. So you can see early on it was taking 100 days, then 30 days, then 10, then 7, then 5. So we really have been in the middle of a significant growth, and hopefully that's starting to plateau right now.
All right, thank you for that update, Stuart. On. Okay, here we go. First question. This one is for you, Dr. Wayman. When the vaccine comes available, will it be in a 2-shot? Will it be 2 shots? And if so, what is the time period between each?
So both of these vaccines, the Pfizer and the Moderna, will require a second dose. The Pfizer one will be 21 days later, and the Moderna 28 days later.
The next one also, if so, how will we know when to get a second one and where? Is there a tracking or record kept to receive the second one?
So the vaccine administration will be documented in the Kentucky Immunization Registry. This electronic system can send reminders. The CDC also has a program which can send text to those that register. And each individual will also receive a card with the date for their next dose.
Okay. Next question. I had COVID last month. Will I need to get the vaccine even if I've already had the virus?
So no one really knows the answer to that question, as we don't know how long the immunity will last after a natural disease. So currently, experts are recommending that everyone get the vaccine.
Next question. How soon will we, the general public, be able to get the COVID vaccine? And who's going to be offering that? Will it be the health department?
So plans for administering the vaccine are ongoing, and we are hoping many medical entities will be able to provide the vaccine when the supply is available, including pharmacies and health departments. We do not expect any vaccine for the general public till around spring 2021.
Few months to go. Next question. I am over 65 years of age and was concerned about receiving the vaccine because of the side effects. Would the side effects from this vaccine be more if I am older than someone that is in their 20s with a strong immune system?
Well, actually, people with stronger immune systems seem to have more side effects because the side effects are mainly due to the immune system responding to the viral protein and mounting an immune response, which is manifest by fever, fatigue, headaches, joint pain, muscle aches. So no, an elderly person doesn't necessarily have to have worse side effects.
But I see Dr. Miles from Russell County has posted a question. It says, Dr. Wayman, comments on early treatment of COVID-positive patients. What was the outcomes of the Senate testimony on, I can't pronounce the medicine, ivermectin? Still a lot of push by some providers on
hydroxychloroquine or whatever that is. So any
I know the
hydroxychloroquine?
yes, was not shown to be a benefit. In fact, it had some bad side effects, whereas the ivermectin, I do not know the results of that one.
He says he's putting some big words out there. Hydroxychloroquine plus antibiotics. I know CDC and NIH still saying caution, but a lot of small studies. I'm getting pushed to review this by some mid-level providers, but I don't see the support.
Okay.
Thank you, Dr. Miles.
Next question. Can children receive the vaccine?
Only if they're 16 and older for the Pfizer vaccine, and we don't know about the Moderna yet.
Will the vaccine be yearly, like the flu shot?
That answer we don't know yet either, because it depends how long the protection lasts from the current vaccine and whether the virus mutates or not.
Now that the vaccines have begun, or vaccinations have begun, how does the local health department plan on educating the public on the safety and importance of taking them? I'm hearing a lot of hesitation and feelings that people are hesitant. Go ahead, Sean.
I was just going to say, we will start doing educational releases to the public on our website and on our daily briefings that we put out on social media and so forth, and putting information from the CDC and different medical studies as that becomes available. So we will, try to encourage the public to as much as we can and educate everyone with all the current information that we have. We've not done a lot of promotion of the vaccine yet because, simply we haven't gotten the vaccine in our area yet. But as of our daily brief today, we're going to start putting snippets there, and we're going to start putting daily vaccine information on our social media website. So that's something we covered this morning in our operations meeting. I see a couple of more questions on our chat. It says, Judge Calwin from Adair says, constituents ask me if I think the vaccine is safe. The concern I get the most is because it was developed so quickly. What are your thoughts on the safety of the vaccine? So, Dr. Wayman, you're our medical director. What's your thoughts?
Well, the only thing that was quick is that maybe we didn't get 100,000 in our trials that received the vaccine, but we did get 20,000. And out of those 20,000, approximately 15% had fever, approximately 50% had fatigue, but the control group, 25% of them had fatigue. So all the side effects were the side effects that we are normally used to from vaccines. And nothing really was seen that was associated with the vaccine that was terrible. So that's all I can say. 20,000 people received the vaccine. Now, it depends on you whether you consider that enough data. I'm sure we will get some other side effects that may crop up when we get to hundreds of thousands of doses and millions of doses. But you always have to balance the risk versus benefit of any treatment. Tylenol is not necessarily good for you, but we all pop it on a regular basis.
And you got to remember that there's side effects to any medication. And when you buy a bottle of aspirin, there's a list of side effects in the bottle. So, we all have taken aspirin forever, but that doesn't mean there's not a list of side effects. So that's just the way it is. Another question, I'm not sure, it's KY Nisi. I keep hearing about the tiers for distribution. If someone has a comorbidity or older, will they have to wait until it is released for the general population? Stuart, do you want to try to answer that?
Yeah, I can say that the tiers are changing. it's our thought that they would not have to. Of course, the healthcare workers are in the first tier, and then what's called Tier 1A, and then we have a Tier 1B, where you have other essential workers. And when I say that, I'm talking about people who are vital to keep the country running. People like the potentially those that work in our food production chain, not our food service chain, but our food production, who makes our food. The people who deal with our utilities, like our water and our electric, so those people. And then we have those people with that are elderly and comorbidities, and they're still looking at, even as of yesterday, Sean was on a meeting, and they're still looking at how they're going to address that and how they're going to phase those vaccines out to people in these different tiers and these different age groups and these different groups of comorbidities. So a lot of that stuff is still being looked at.
And long-term care residents, they're in phase 1A, so that, they are our most high-risk population. They tend to be the older, and they tend to be the ones with compromised health already. So that group is going to be your group that's most likely to pass away and your group that's most likely to be hospitalized. So by working your way through that group first, you're relieving a lot of pressure from the hospital system. And so that's how, and that'll get a lot of our really high-risk folks. Then you get into the essential workers, food production, and so forth. As we get into the next layers, we'll just have to see how that unfolds. Right now, we're trying to work through the 1A and the 1B healthcare workers, essential workers, and long-term care. Right now, we don't have enough vaccine to do that. We don't have any vaccine in the area yet. Some should start coming in hopefully next week, and we'll start doing that. It'll, at the beginning, while the nation is ramping up production for our country and the rest of the world, the vaccine will trickle in at the beginning, but as time goes on, there'll be more of it, and at some point, we'll have plenty to go around for everyone. As Dr. Wayman said, probably by the spring, I think it was Dr. Wayman, did you say spring? That we expect, hopefully by the spring, to have it pretty widespread. So Dr. Wayman and KY Nisi says thank you both, or they both say thank you.
All right, next question. I've been hearing that once infected, you have approximately 3 months of immunity. Then you could get COVID again. Is this true? Then today, another person came into the office and said you could get 7 months of immunity. Is this true? So how long does immunity last if you have been affected, Dr. Wayman?
Yeah. Dr. Wayman and I both answered parts of this. I'll answer my part first, and then she can answer the medical part. I looked at our statistical data, and what we have had some reinfections in our district, but we're talking about 0.02% of our population, or 0.002%. So we're talking about an extremely small number so far that's been reinfected, and that could be due to waning immunity. It could be due to a slightly different strain. It could of the virus. It could be more likely just false positive test results for one of the tests they had. But we're talking about an extremely, extremely small percentage of our total population. So I don't want to focus too much on that 0.002%. I think we need to focus on the bigger picture. But Dr. Wayman, what do you want to add?
So I just want to add that everybody's immune systems are different. And if you have a very strong immune system and you mount a good response, both from the antibodies and from your cellular response, you're much less likely to be reinfected at whatever time. Who knows, 7 months, 12 months, 2 years. So it's totally dependent on one's immune system. But as Sean says, this is a really rare event at this time. And the original reinfections that were actually written about probably mid-year every single person that was reinfected had a slightly different strain of virus. Now, we're not testing the people that we see for the viral strains, so we don't really know, but we know that there is no major shift in the viral genome at this time.
Yeah, so genetically the virus is not mutating so greatly that it's just doing very, very slight mutations right now.
Right.
But I mean, even if this does turn into having to be an annual vaccination, it's still far better than what we're going through right now. So, hopefully getting your vaccination and then your booster a few days later will give you long-term coverage for this. But even if you have to get it each year like you do the flu shot, I mean, that's going to be a far better situation than what we're all having to go through right now. So there is good hope that things are going to get back to normal. We're closer to the end of this than we are, hopefully, than we were the beginning of it. So it started in March, and hopefully by the end of spring we'll have a lot of people vaccinated. So hopefully we're closer to the end of this than the beginning of it.
Dr. Wayman, one other thing I've been hearing, and it's not on the questions, but can you help to dispel the sense out there that vaccines give people the virus? Just like people will say, I took my flu vaccine and I ended up with the flu 3 or 4 days later. And I'm sure the same thing will happen, of course, with the COVID vaccine. People will take the vaccine and then maybe a few days later they may end up with COVID. Can you explain that actually how that works?
So the vaccine does not contain any virus at all. It contains a tiny little bit of, it's a messenger RNA, which then makes your body produce a certain protein, which is the protein on the surface of the virus. So this little protein can't give you the disease. Now, if you happen to be unlucky and really get it 3 days later, then you were probably already incubating that and your immune system hasn't been primed yet. So if you have symptoms the next day, that's more likely to be due to the vaccine and the immune system responding to the vaccine. But maybe several days later, it may be that you had already caught the coronavirus and it's only just then manifesting its symptoms.
Because it's going to take several days, up to a couple of weeks, for you to build up that immunity. And if you were exposed beforehand, and it's kind of percolating in your system, then yes, it is true you can end up with the virus, but it is not from the vaccine.
Correct. Okay, thank you all. Next question. How many people in Kentucky had symptoms after the vaccine delivery this last Monday and Tuesday, and what were those symptoms?
Well, to start with, that's way too early for us to even know what happened with those, how many people actually got the vaccine and who had side effects. But from the trial of 20,000 people, as I think I said earlier, 15% had fever, mild or moderate. Half of them had fatigue, but so did quite a lot of the control people that didn't get the vaccine. And quite a lot, about 50%, had headache, maybe chills, joint pain, and muscle ache. So they're the predominant side effects that we expect people to have. Not every single one, but quite a few.
Next question. Do we have any data on the similarities of those who have had serious cases and or death? I guess what I was wondering is if the data seems to indicate things like tobacco use, things like that, other than just age and comorbidities.
So we do know that comorbidities, and there is data out there, do produce or increase the risk of severe illness. Age, advanced age, is the strongest predictor of severe disease. However, heart conditions, chronic kidney disease, obesity, sickle cell disease, smoking, diabetes all increase the risk. We know that. There are lots of studies to show that.
Yeah, one of the most common questions we get on social media is people will say things like, how many of these people that died from COVID-19 died from only COVID-19? And the point is, almost no one in Kentucky who dies of only something. Almost everyone has comorbidities. You know, almost everyone in Kentucky either is obese or has diabetes or, you know, some comorbidity already. When, you know, we get our death data either from the coroner's office or we get it from the attending physician where, if it was at a hospital where the death took place, we get the cause of death from either the attending physician or the coroner. Now, there may be another way we get that, but that would be how we get most of our death information. It's what the coroner would list on the coroner's report or the attending physician would list. So when we're reporting COVID-19 deaths, you know, that's what either the coroner or the attending physician has listed as the primary cause of death. Does that mean that they had no other comorbidities? Well, almost everyone in Kentucky has a comorbidity. So, you know, it's kind of I think that's just people's way of trying to spin the data to make it sound like, no, this is not bad. You know, you'd be hard pressed in Kentucky to find anybody that doesn't have some comorbidity. Even if you're not sick at the moment, you've probably got some overweight, diabetes, you know, some condition going on. I'm not sure if I'm explaining that clear. Does that make sense to you, Dr. Wayman?
It does, and I was going to add that many organs in your body have receptors for this virus. So if that organ is already debilitated to some degree, and then you add the virus to it, you can see that together you have more illness than if your organ was pristine and healthy.
I've also, you know, it seems like society has almost accepted that it is okay that there's going to be a high number of elderly people that pass away from this, and you know, that's a shame. I know with the elderly people that I've communicated with, a lot of them feel very much betrayed. You know, they feel like they gave their lives to build this country, and now their country's willing to just cast them off and consider them, you know, collateral damage of this disease, and that collateral damage is okay. I've not spoke to any elderly person that wants to voluntarily give up a single day of life. They all want to live as long as they can live, and you know, I don't know what else to say. I mean, we need to have a little bit more respect for the people that built our country than that, I guess. That's what I'm trying to say.
Okay, I'm on my last question, Sean. I'm not sure if there's any more in the chat box.
I don't see any, but if anyone wants to chat a question, it would be the time to do that.
Okay, last question. What are the 4 top places where COVID seems to be originating currently in Prairie County?
That's a little bit difficult question to answer. We have a pie chart or a donut chart or a ring chart on our website that when we do the case investigation, we ask people, you know, where have you been the last few days before you tested positive for the disease, so we can kind of get an idea of who all they might have exposed. And so we jot those things down. That does not necessarily mean that they either got it from one of those places or that they spread it at one of those places. This is just places that they were at. So I can tell you for Macquarie County, the most common places of our current active cases in Macquarie County where people were at who contracted this is long-term care facilities. That would be residents. That would be staff members too. And it could be family members of staff members if staff members brought it home. Family is the next highest situation, you would have been around family members, which is a very common thing. The thing to remember about family is, COVID-19 don't originate in the home. It's coming into the home from the community. So you're going out into the community and either picking it up at church, you're picking it up at work, you're picking it up at someplace you're visiting. So we do see it transmitted in the family a lot because that's the people that you're closest to for the longest amount of time. But it's not originating in the home. It's coming from the community into the home. Businesses, that makes a lot of sense too, because where are you at if you're not at home? Well, most of the time you're at work. So businesses would be the next highest place. And then the next highest one was schools. You're going down the list, you get travel-related, medical, facilities, restaurants, recreation. Places of worship is all the way down at 1% right now. People will ask me, well, schools are not having in-person instruction. How can schools still be in the top 4? Well, you got to remember these categories are very broad. When we're talking about schools, we're talking about universities, we're talking about high school, middle school, elementary, we're talking about training programs, vocational programs, any school-related program. We're not just talking about students, we're also talking about staff. And even though these places may be closed, they still have staff that go there and work as their place of business. So schools can still be in the top 4. McQuarrie still in the top 4. In our district, I think last night schools dropped out of the top 4 as places people had visited. So that was your McQuarrie County breakdown. We've got a question here. Is there an easy way to explain what mRNA is to others? That would be you, Dr. Wayman.
Well, messenger RNA is the I don't know if it's easy, nucleic acid that determines the sequence of necessary to make a certain protein. And the virus gets into your cells and it has to make more of itself. So this little messenger RNA tells the system, make this protein or proteins. So the virus has many proteins, but this particular messenger RNA that's being put in the vaccine is just one of the messenger RNAs that the virus has. And it's only going to produce what we call the spike protein, which is the corona part of the coronavirus, all the little round bubbles on the surface, which are the ones that connect with the receptor, which is in many, many cells of your body. And when that happens, the virus enters your cell and reproduces itself and makes more, makes you sicker. I don't know if that was easy or not.
Well, I mean, all of us, Dr. Wayman, we all have a genetic code, right? We all have genes.
Correct.
We all have a genetic code. And RNA is part of your genetic code. And what the virus does is it kind of goes in and rewrites your genetic code and it starts replicating itself.
Well, messenger RNA is a little bit different because that's the one that says it's the printer,
Yeah, so kind of what Dr. Wayman's saying is as this messenger RNA goes in, then it gets in that cell then creates this protein. And then that protein is what acts as the vaccine.
Right.
Treats what's attacking the body. So it can attack that.
It's pretty hard to make one of these, concepts easy to understand on a very basic level. I mean,
we all need science in school.
Science this is stuff you learn in college and genetics class and biology and stuff. So it's really hard to break some of these advanced concepts down on a really simple level. Basically, the virus gets into your cells and starts replicating, and
It's the program that determines what you print.
So the vaccine causes, and it's delivered by messenger RNA, but it causes your cells to make that protein that's going to attack that virus.
There's probably some really good YouTube videos out there that'll explain all this and diagram it out and flow chart it and show you. That would explain it a lot better than we're trying to explain it.
I think you all done
I
a
would
good
encourage-
job.
Well, we tried. I felt like we fumbled around a little bit, but it's difficult to break some of this down into a simple thing. But okay, I don't see any more questions, Tracy. Is there anything else that you have that you want us to go over today?
Do you know how many cases we have today, Sean? I don't think you shared that, but do you have that
No,
information?
I haven't had it. When I called this morning to check on something else, I asked if it looked like this was going to be a big day. She said it looked like, you know, it's kind of equivalent to what we've been experiencing this week. So if that holds out, that'll mean that, you know, we'll have another day lower than the equivalent day last week. I hope that's true. I really want us to be plateaued and improving. I worry, you know, that as the governor lifts restrictions and as people hear the news that it seems to be slowing down, and as people hear the news that there's a vaccine coming, that, you know, people will lose their enthusiasm to be vigilant with social distancing and masking and so forth. We're still a good ways away. Spring is still several months away, and we can see how in just a few weeks how big this thing can explode. It is true we're getting close to the finish line, but let's take this on to the finish. Let's all sacrifice social distance, wear masks, do the things that we need to do right now, and then hopefully by the spring there won't be as much of a need to do. What happen is for this to blow up really big again after the holidays and a bunch of people die that doesn't need to die just a few days before they could have gotten the vaccine or could have received the vaccine. That would be terrible. One comment here, I appreciate it. I keep hearing it's going to change your DNA. That was helpful. Thank you. So I think that's it. We need to get our flu shots, Tracy. You always talk about that. Your background has busted on you. See half of your wall back there. Get your flu shots. Get your coronavirus vaccine as soon as you're eligible for it. And in between now and then, social distance, wash your hands, mask. The more people you're around, the more chance somebody's going to give it to you. We still know in our district about 1 kid that end up in the hospital, and about 1 out of every 65 or something end up passing away, and that's still a lot of death and a lot of suffering we have now between now and the spring. So do be vigilant. Any other closing thoughts? I think that's it, Tracy.
All right. Thank you all for joining us. We'll see you in 2 weeks. Thank
you all. Have a good
Bye-bye.
day.